We are in for a real treat with this next session. Nick Desai is one of the true transformative voices for transformation in healthcare, and we're excited to have him as part of the Telehealth Academy. Actually, Nick I think this is one of several presentations he's doing this week, one actually based out of Germany. Nick Desai is co-founder of Heal and HeyRenee and currently serves as CEO of HeyRenee. HeyRenee is the latest startup for Nick, who is one half of the husband and wife team that founded award-winning home-centric primary care company Heal nearly 7 years ago. Founded in June of 2021, so brand new company, HeyRenee is a transformative digital health assistant specifically designed for older and underserved Americans to coordinate, communicate, and connect all aspects of their health care. From October of 2014 to February of 2021, Nick led Heal's torrid growth as CEO, expanding Heal's doctor house calls to 10 states, raising over $200 million in investment capital. That is really hard to do, Nick. Congratulations on that. From top investors, including Humana, Fidelity, Briar Capital, among many others. Nick also led Heal's business development, winning contracts with over 50 major employers and insurance partners, including Google, Hyundai, Samsung, Anthem, Aetna, United Healthcare, and others. And perhaps most importantly, Nick, who is an engineer by training, led Heal's product development to innovate industry-leading capabilities, including the first ever upfront price transparency in healthcare, on-demand same-day doctor house calls, real-time remote monitoring, and one-touch telehealth. Nick actually, I think, often says users shouldn't learn technology. Technology should learn users. Heal has been recognized as number 13 on the 2020 CNBC Disruptor 50 list, the 2019 Consumer Electronics Show Small Business of the Year, and number 114 on the Deloitte Fast 500, among other awards. Nick earned his BS in electrical and computer engineering from UC Irvine and an MS in electrical engineering from UCLA. He spends most of his free time playing with his 3 rambunctious, and that's his term, young kids, eating pizza and taking walks with his best friend and wife, Dr. Renee Dua. Nick is a first-generation immigrant to the U.S. and was born in Mumbai, India. Nick, it is really an honor to have you. Thank you for doing this. To our participants, if you have questions as Nick goes through his presentation, please enter them in the chat that it's the bottom of the screen and address them to Eric, and he will get the questions to us, and we'll have time at the end for Q&A. So with that, Nick, we'll turn it over to you.
Thank you, Phil. Thank you so much for that very gracious introduction. Thank you to the Telehealth Academy, to you, then the Disruption Lab, to Olive, and to the Nashville Entrepreneur and Technology Center for hosting this incredible series of speakers and programs, of which I'm a small part. Whenever I talk about telehealth, right, and this is called the Telehealth Academy, so people are here ostensibly to learn and become smarter and more knowledgeable about telehealth. I always feel like I need to start with some basic stats, right, about the world and about here in the US, because telehealth unto itself is not healthcare. It would be like saying a doctor's office is healthcare, right? A building is not healthcare, and your phone is not healthcare. These are tools or vehicles or places where you can receive healthcare. But telehealth is particularly powerful, exciting, interesting, and transformative because in the world, there are 5.3 billion people who have regular access to a smartphone device. 5.3 billion. That exceeds the number of people who have regular or timely access to a doctor by about 1.4 billion people, right? There are 1.4 billion more people who have this than get to see a doctor. And that represents potential to reach a lot more people, a lot more cost effectively. And that might seem like a global statistic, but right here in the United States of America, about 100 million people do not see a doctor in any given calendar year. That's pre-pandemic stats. The pandemic has changed things around because people are seeing doctors more for pandemic reasons, less for regular reasons, which will have its own long-term ramifications. But the about 100 million people are not accessing care regularly because of transportation issues, because they can't get off the hours, logistics and demographics issues, because of healthcare coverage, because of mental or physical health challenges, disabilities, whatever you want to call it. And all of those people, virtually every single one of those people, has access to a data-enabled smartphone. When we talk about telehealth, though, it's often construed in the very narrow and very first generation V1.0, V0.1 sense of it, which is, oh, can I use my tech-enabled device to video chat with or speak with a random provider about a random problem without context, without data, who I don't know, the teledoc experience as it has historically been known and called, and I'm not bashing teledoc, but that kind of company, right? That's the very tip of the iceberg, okay? And it's sort of like saying that the only use of a cameras on my phones and on my computer are for chat roulette, rather than what we learned all in the pandemic is this is an indispensable way, my camera phone, to keep in touch with my work colleagues, my friends, my family, and my own children when I am away from them from work. And it is an extension of a deeply personal, human, or very productive work relationship, right? But when it comes to healthcare, the mobile environment and telehealth have a capacity to go even beyond just the relationship aspect of me talking to my doctor and me talking to someone who knows my health and health data and context. This is a diagnostic tool. There are apps out there right now that allow me to hold my finger. For years, we've always been able to use our phone as our pedometer, count our steps, all that kind of stuff, right? But it's also an accelerometer. It can tell if I've fallen, right? I can put my finger here and count my blood pressure, my heart rate variability, my pulse ox, my stress. There is now apps that let me speak into the phone for 30 seconds, which very accurately detect if I have mental health issues, stress, sadness, depression, anxiety, nervousness, fear, other issues that a doctor or some kind of trained professional should be taking a look at, or if medication should be involved, right? But it goes beyond that. There are therapeutic purposes, right? Today, we all know about companies that have the capability that an app on a smartphone, and for diabetics, instead of pricking your finger and then using a strip and then manually reading the thing, you prick the finger and it goes onto the back of your phone with a little attachment and it gives you that data point, right? Just today, I read about a company that is doing smart doses, as someone who's had asthma in his life, smart doses of your inhaler, so that you take the right amount of doses, the dosage based on your breathing level. And that might sound like a trivial thing, except 1 in 4 people on an inhaler for asthma type issues will not press the thing down before inhaling, and they will get no medicinal value of that, right? So we are talking about a device that is transformative in its capability across the breadth of healthcare. But that being said, that transformation will only happen if it's actually done right and smartly in the interest of the consumer. The speaker before me was very aptly pointing out that the revenue models and reimbursement models are changing, and during the pandemic, stuff that was being paid for is not being paid for, right? But let's go even step beyond that, right? Which is, in the United States of America, since 1985 to 2020, pre-pandemic, the average life expectancy in the United States increased almost none, right? Plus or minus 6 months, there's been no meaningful increase in life expectancy in the last 35 years. During the same time, for inflation-adjusted real 2020 dollars, so GDP and inflation-adjusted dollars, the cost of healthcare increased fourfold. We went from about $1 trillion spend to about a $4 trillion spend. $1.3 trillion of which about a third of the total spend goes to the administration, bureaucracy, billing, and overhead that is introduced into the system by health insurance, and the billing and the coding and the collection and the charting and all of the complications that come that have doctors spending about 2/3 of their time on bureaucracy and administration and about 1/3 of their time on seeing patients. And it has had over the last 20 years, a dramatic change in the way doctors practice medicine, away from private practices where doctors know a patient, their family, and have a relationship, far away from the year I was born in 1970, when almost 50% of primary care visits in America were still delivered by house calls, to a point where 84% of doctors work for large health systems and institutions where they're shift workers and they clock out. And that's it. It's somebody else's problem at that point. And it's not, we always talk to the people say about vaccines, oh, talk to your doctor. Most people don't have that doctor relationship. And the impact of that is that people are getting care that is less data driven, despite the availability of more data, less timely, less personal, and less connected to the actual life choices they're going to make. I get a prescription for medication I have no way to go pick up. I get a prescription for medication I'm supposed to take with milk, but I'm too embarrassed to tell the doctor that I can't afford milk. That's 1 in 4 seniors in America, by the way, right? Who cannot afford the food that they are supposed to be eating along with the medications that they're supposed to be taking, right? What does all of that have to do with telehealth? What does all of that have to do with transformation in the telehealth economy? Here's what it has to do. We are at a unique point to dramatically change the healthcare system, fundamentally starting with a conversation around insurance itself, right? Do you know why insurance doesn't work for healthcare? It's not because of billing and bureaucracy. Yeah, those are all symptoms. But the cause is because insurance works for things that people don't want to use and insurance companies don't want them to use. I have life insurance. In case something unfortunate were to happen to me, my wife and children would be well taken care of. I don't want to die. My wife doesn't want me to die most days, and my kids don't want me to die, okay? So it works. The insurance company's incentive is aligned with my insurance. I have fire insurance for my house. I don't want my house to burn down, and the insurance company doesn't want my house to burn down. We treat healthcare in America the same way, that we create this environment where insurance is something that you have and you feel fortunate enough to have that you don't feel like you should use, to the point that 44% of Americans don't see a doctor in an average calendar year, right? But insurance should be like, healthcare, should be like education. It should be something we proactively and freely provide to everyone as an investment, like national defense. Keep us safe, get us educated, and give us a foundation of good health, nutrition, preventative health care, vaccines, all of those things. Yes, insurance should exist, and it should exist for the catastrophic things. See, I drive home the 2 miles from my house, my office to my house, and I get hit by a car and have a catastrophic car accident. Or despite all the preventive care, I'm diagnosed with some devastating, pancreatic cancer, which is often only caused in the late stage and costs millions of dollars. Or someone has a NICU baby that costs $2 million, right? You don't get to choose these things. They're sort of chosen for us, and insurance should exist for that. But healthcare should exist as a system in which we proactively provide great care and access. People talk about in telehealth the usage and, is post-pandemic the usage of telehealth is declining. It's because it's done wrong. Imagine if right now on your phone, just as easily as you can call your family member, anyone in America could hit a button, or just as easily as you can call 911 when you have a life-threatening emergency. Imagine if you could call 811 when you don't and talk to a doctor. And that doctor knew you and knew your data, and you didn't have to worry about cost or expense or anything. And you could ask those questions. Is this COVID or just a headache? Is this or just that? What do I do about this? And that was integrated into the way I got educated, into the way I ate, into the way of all of those things. And all of that is a way to say this device, telehealth on this device, has the potential to bring about that kind of change, right? Now, what happened in the first generation of telehealth is the chat roulette of healthcare. Let me talk to a random provider, typically to either get told, call 911, here's a prescription for a 3-day supply, or this is an emergency, go see your doctor, right? Then we've evolved into what I call Generation 2. Generation 2 is a myriad digital health point solutions. You still have your chat roulette, okay? You have some platforms that say, you talk to your doctor on telehealth, okay? And that's an important advancement, except those doctors, are still mired in old billing systems, old bureaucracy. They're figuring out, trying to do the competitive math, or is it better for a patient to come into my office for me to see them to make money? I still have to run around between my office patients, and this is the second part of my day, or after hours, or whatever, right? There's that. Then there are all these vertical point solutions. There's digital health solutions for diabetes. There's digital health solutions for my Viagra. Not Viagra in general. I'm not making a comment about my own personal needs. There's digital health solutions for testosterone level, for mental health, for heart health, for prenatal care, for postnatal care. I could go on and on and on. And most of these are completely disconnected from each other. Except here's what all of us know as healthcare professionals on this session right now. What do we know? Is that digital health may be vertically organized, but we're not vertical human beings. We're human beings. And the person that has obesity also probably has diabetes. And because of that has hypertension. And because of that has mental health issues and may have a whole host of other issues. And they're not going to sign up for 8 different apps that know a small part of their care. We also know that integration of care, the factoring of social determinants of health, the understanding of what happened to me last week, how well I slept is not just some fancy ring that cost a few $100 that I put on my finger for self-trackers. How well I slept is important to whether I'll eat well, is important to whether I'll take medications, is important to whether I'm likely to have an acute episode, and it's a vicious or virtuous cycle from there, right? And all of that can and should be integrated horizontally across this type of device because it is the most widely distributed, most prevalent, most universally available place to deliver horizontally integrated, data-driven, proactive, and preventive care to patients of all ages. So that what we don't do in America is what we're really good at doing, which is wait till people are really sick, put them in a hospital, and do the miraculous. I live within a few minutes of UCLA Medical Center, one of the best hospitals in the country, and where people fly from around the world to separate conjoined twins and to reattach a hand from a wounded veteran. And those are the heroic stories we hear about. But that's not the bulk of healthcare. The bulk of healthcare should be, did you eat your greens today? Did you take this medication? Did you take your metformin? Did you do this? Did you sleep well? How are you feeling today? And acting upon those indicators to guide healthcare to a better place in context of social determinants of health, in context of my home and family lifestyle, in context of the other apps and services I have on my phone, because there's no way horizontally integrated healthcare doesn't need to also integrate with over-the-counter medications, with food delivery, with services like transportation, with nutrition counseling, with my social circle, with the way I entertain myself and get entertained, with the content and services I'm likely to consume. Those are because healthcare is life and life is healthcare. So these things have to be horizontally consumed, right? So 7 years ago, when Renee and I set out to create Heal, the doctor house call company, it was pre-pandemic, pre-everything, and it was pre-telehealth to a large extent. And the goal was to showcase the reality that the right place to deliver primary care is in the home. Today, 7 years later, we as Heal have delivered 300,000 house calls and raised a bunch of money and all the great stuff Phil told you. But fundamentally, we'd like to think we were part of a catalyst to transform an industry that it's widely understood that the best place to deliver care is in my home. Well, along came a pandemic and it accelerated the adoption of digital health and this digital front door. And now there's a potential to interact with every patient in their home using video capabilities and then using the real person capabilities to draw labs, administer infusion therapies, and the kinds of things that still require human-to-human contact, right? So I look at this period of time, I look at the last 5 to 7 years as a time of incredible innovation to prove out the models in value-based care, home-centric care, remote monitoring, real-time vitals, all of these things could possibly even exist. Then the last year and a half became about holy cow, there's a pandemic. Let's use whatever there is. And telehealth was at the forefront of that because no one wanted to go to the doctor's office and get exposed to someone with the pandemic. And then this year has been about, well, let's invest because there was growth in the pandemic. Everyone's going to move to digital health. But what's missing is the transformation that Facebook made from MySpace. And most of you on this call are old enough to remember, like I am, that phones had cameras long before this guy came along, right? What did Apple do that was so transformative? It was the front-facing camera. It wasn't pictures of other people. It was pictures of me. And along came the selfie, and along came Instagram, and along came TikTok, and and in a similar way, the transformation that's needed now is what we'd like to think we're working on at HeyRenee, which is horizontally integrated, patient-centric interfaces that tie all my doctors, all my healthcare partners, my pharmacy, my physical therapist, my mental health professional, all my data together in one seamless integrated user interface so that, and what is concurrently needed is a fundamental disruption in the revenue models so that the fee-for-service model needs to go away. Value-based care models need to be focused around real value so it's not so easy to just manipulate a risk score, increase a risk score on a patient, and make money on that. And we've seen almost every large insurance company in America have to pay fines around this. Just last week, a data point came out that Medicare paid out an extra $9.2 billion because of MA plans gaming RAF scores, right? That's not value. That's just gaming the system and taking money from the system. What we have to deliver is on real aligned incentives, real value, real patient engagement, real preventive care, and from cradle to grave, and really before cradle, from prenatal to palliative care and everything in between, there has to be proactive healthcare. And this is a platform that has the potential to do that. And many of the tools that will be part of that, right? Companies that I think of as innovative, Hospital on Mobile and Sond Health in the detecting your anxiety in Hospital on Mobile, which does the vitals on your fingerprint, and a few other companies do that. And so many interesting companies in these spaces are out there, and there needs to be a unification and a fundamental rethink of the doctor-patient relationship. I have spent a lot of time talking about how the doctor-patient relationship has become disintermediated and how doctors don't connect with their patients because they don't have the ability to connect with their patients because they're in this institutional system and then so on and so forth. This is where they can reconnect. But we don't need to think about a doctor who's running between office patients, trying to get in a telehealth call here and there so every minute's a revenue generating minute. We need to think about only those things that require an in-person interaction should be done in person. First in the home, second at a facility, third at a hospital. The hospital is the place of last resort, right? Bureaucracy in hospitals are where healthcare costs go. Okay. And yes, they're really important for certain things, but mostly useless for most things. And in that environment, we have an opportunity to really rethink the use of a doctor around analyzing data, looking at a patient's information, and being there more available to the patient and being monetized and paid based on the overall value generated for that patient. Right? And that applies not just to primary care and pediatrics and prenatal care, but to many of the specialties, cardiology, nephrology, endocrinology, all of the specialties that deal with what we call chronic conditions, right? And if we do this correctly, we have the potential, right? Right now in America, there are 40 million CKD patients with chronic kidney disease. There are 1 million people on dialysis. Those 1 million people cost as much in a year as the 40 million people on CKD, except 92% of those CKD patients are going to end up on dialysis without a fundamental change in the way we manage diabetes, kidney disease, hypertension. What is kidney disease? Diabetes and hypertension, right? And obesity. Why? And I speak about that as if I know anything. I should give credit where credit's due to my wife, the nephrologist, my co-founder in HeyRenee and Heal, my best friend and my life partner, who is a practicing nephrologist from whom I've learned these things. But the point is, we have the potential to fundamentally arrest, slow the pace of chronic disease, slow the pace of disease progression, not just manage disease, but improve outcomes. And what does that mean? It means human beings spend more time living their lives, because when you talk to someone who's 50 or 60 or 70 or 80 or even 90, their goals aren't about closing care gaps or STARS measures, and they're certainly not about reducing MER. You know what they're about? Playing with their grandkids, going out with their friends, dating, being more active, keeping a social life, right? And we can help people do that by integrating across these platforms horizontally to the true potential in a paradigm shift in the way we pay for care, in the way we receive care, in the way providers provide care, in the role of data of care. And we, as HeyRenee, hope to be one important company in that space, though there will be a lot of others, and I look forward to working with them. And with that, I will say thank you to everyone for listening to me, and I will open up for questions. Thank you.
All right, Nick, you got me fired up. That was amazing. Thank you so much for laying out the kind of the argument of where we are and what telehealth is doing for us, but the opportunities where we're just beginning to tap into some of those opportunities. Let me remind people that are listening, our attendees, that I think I said to chat your questions to Eric, but if you would actually, in the drop down, you will see Haley's name, and if you will chat them to Haley, she will get them to us. Nick, if I could start with just a question for the providers who are in the audience, who are kind of early. They responded during the pandemic, but haven't made a great investment in telehealth at this point, kind of getting started. What's the one piece of advice you would give to them to really be effective in their telehealth initiative?
Yeah, so the first thing I would say to any provider who is listening today is, first of all, thank you. We learned over the last year and a half in America that heroes don't wear capes and they don't put on football helmets, and it's not about how high they can jump. There are doctors and our nurses and home health workers that have been the difference. As many as almost 700,000 people died in the pandemic. It would have been 3 or 4 times that much if it weren't for putting your lives on the line for our lives. And I'm grateful, right? I'd be remiss if I didn't point that out. The most important advice I would give is be bold, right? You have been screwed. You've been rogered by Epic and EMRs. You've been rogered by hospitals. You've been rogered by bureaucracy and billing systems and malpractice across the board. And there's this assumption that the people who are doctors, somehow they are so happy to be making $180,000 to $240,000 a year that they'll just put up with any amount of crap without realizing that most of you could make a lot more money working as software engineers at Google, having spent a lot less years in school, right? Being married to a physician, I appreciate this. And if you're a nurse, the same thing applies, right? So be bold in your thinking. Don't think about how do I keep this and make a little change. The most important thing doctors and providers do is limit themselves. The tools and the technology are out there for dramatic changes in the way you provide care. When we first started talking to doctors about Heal, I said this to Renee, my wife, who's a physician. She said, I'm not going to ever convince doctors to go on house calls. This is going to be a tough thing. And they see 40 patients a day in the office, and how are we going to pay them today? I said, you get me 3 doctors, I'll get you the rest. And she did, and we did. And we're operating in 10 states, and there's 200 providers. And it's fundamentally because we showed doctors a way to actually return to what they actually love, which is practicing great patient care, seeing their patients flourish, having better outcomes, spending less time on bureaucracy, not spending their time chasing down a patient. I will never forget when we were pregnant with our 3rd child, our daughter Layla, who's about to turn 3. And if you think I'm spoiling her, you're right. That we were in the doctor's office, and when we came to the front, and the doctor came up front, and her office staff was there, and she's like, Nick, by the way, from your last visit, you owe $1.63 in copay. It's like, really? You're a Stanford-trained OBGYN. This is what you're being forced to spend your time on? So the tools and the possibilities out there for you to be dramatic and bold in fundamentally changing the way you get to practice your unique life-saving skill and the art and science of medicine in ways that help people more, in ways that help your life and lifestyle so you can be home for your kids more and in a way that makes you the same or more money.
So, Nick, you've described the impact of telehealth, acting boldly, and across different sectors, how it's going to have impact. Thinking about bricks and mortar healthcare, what do you see the impact there over the next 5 to 10 years in terms of virtual care, the model you've described, and where the trajectory that we're on?
Yeah. So remember, I know it feels like a world, a time gone by, but it was only 2019 when America was talking about the retail apocalypse. And Sears went out of business, and Toys R Us went out of business, and that even got worse, right? The doctor's office is dead, period, right? If people don't see the primary care doctor's office as a place of receiving care is dead. This is why so many health systems and hospital systems are buying primary care practices to consolidate and move, and primary care practices are selling out, right? The doctor's office is dead. I can't say this strongly enough. Whether it's because a doctor comes to your house or whether it's because you talk to a doctor here, right? You're not going to go to a doctor's office. What you are going to do, okay, is you're going to interact with the doctor more frequently here. What will grow is surgery centers. What will grow is delivery centers for people why does a mom having a new baby belong in the same place that someone having hip replacement surgery is? Just because they built the building that way. There isn't that much rhyme or reason to it. So you will see specialty, lower cost surgery centers, baby delivery centers, cancer infusion treatment, but you'll also see more treatment move out of the home. And hospitals will exist for the top and bottom floors, for the emergency room and the ICU, right? And everything else will be disintermediated. And that will bring costs down, quality up, accessibility higher. And those are all very, very powerful, positive forces.
Thanks. This is a question from one of the participants, and it's: how does horizontal integrated vision of data work with holistic health, even beyond healthcare industry, to reach wellness and preventive services?
It's a phenomenal question. Thank you to whoever asked that, because that's exactly where we need to go. Your mental health is as much study after study has shown this. If you go take a walk on the beach, if you go take a walk in the woods, right? In Western Europe, they prescribe taking walks as part of treatment for depression, right? Taking a walk in the woods, whether it's yoga, whether it's wellness, whether it's mindfulness, whether it's meditation, whether it's, some of the supplements and things that are out there. And I want to be very careful here because there are very good and useful ones, and then there are very shammy ones. So I'm not going to pick on any particular one, but the point is to say all these things are a continuum. From, in Japan, they have a life expectancy 6 years longer than America on average, and they spend 60% less per capita on healthcare, right? Why is that? Because in Japan, there's a lot of reasons, but one of the most important ones is you cannot finish grade school, forget high school, in Japan without learning how to eat nutritiously and grow vegetables, okay? So all of those things, wellness, mindfulness, they are all part of a continuum, and a doctor should easily be. Let me give a great example of something that isn't considered clinical, but is extremely important, right? 1 in 3 new moms has trouble with their baby latching and needs lactation consulting. Until very recently, that was considered a floofy wellness thing as opposed to a fundamental healthcare thing, right? These are all things that are part of healthcare. Wellness and healthcare are not separate. They're a continuum of the human condition. And the more wellness we do, the less curative and pharmacological and treatment and surgical healthcare we'll have to do. Costs come down, quality of life goes up.
So what about we're seeing some trends, this has been discussed, of telehealth visits declining as the pandemic eases. This person says we're social creatures, want to come in and see their doctor. There's still people who resist virtual care. And how do you address that?
Yeah, I say 3 things. We are social creatures, and let's hope that as we age, we have more social support than our doctor's office visit being our social outing, okay? A very senior medical officer at a very large insurance company said that to me 5 years ago, and I said, you have a pretty grim view of the human condition if you think that the only social outing that seniors should have is going to their damn doctor's office. The second point is that telehealth today is broken. It's not that interesting, and it's not that effective. Are those same seniors that are not using telehealth, and it's often seniors, are they not FaceTiming their grandkids? Are they not WhatsApping their friends? Yes, there are some who are not because they can't, because they don't have the connectivity or they don't have the device. But most of them are. They're dating online and they're chatting with friends online. My 84-year-old father, who has never used telehealth, during the pandemic kept in touch with his cousins all over the country and the world, originally from India, obviously, using Zoom, and he figured out how to use it. And he knows how to use GoodRx because it delivers value. Right? GoodRx is an example of something that seniors have figured out how to use because it saves them money. So telehealth has to be fundamentally better. We can't expect seniors will embrace technology when the technology delivers real value to them, not for the sake of embracing it, when it fundamentally makes their life better. Uber didn't take off because it's fun to order a cab on my phone. Uber took off because I could instantly get a ride and from anywhere to anywhere, not have to worry about the hassle of parking. And same with Grubhub and Seamless and the food delivery services. And because of that, there's an entire industry, think about this, of the shared kitchen industry, right? Why is that a great analogy? Because everyone thought it was going to be a restaurant, they'd have retail, and delivery was the afterthought of the restaurant business. And many fine restaurants actually never delivered food. They just had you come in and pick it up, right? Now everybody delivers. Freaking Nobu delivers, right? 5-star restaurants. What is it over here at the Waldorf? Jean George delivers, right? All of these places deliver. And now there are people who exist to make meals exclusively and entirely for delivery. Same thing's going to happen. And there are food trucks that come close to my house near site care. Maybe there'll be mobile vans for my x-ray and imaging. There already are, but the cost curves need to come down. So the reason we're seeing declining usage is because there's declining utility. We have to fundamentally make telehealth dramatically better. And then back to the wellness question, create into these services social support structures so like-minded people can meet each other either in video or in real life and have social interactions that are less depressing than I'm sitting in a waiting room at my doctor's office reading 13-year-old versions of Us Weekly.
Fascinating and great analogies. So I've heard you, Nick, ask this question on podcasts, so I'm going to ask you the question, and that is, which of the following will have the greatest impact on healthcare? And that's Google, Apple, Amazon, or Walmart.
Walmart, 100%. That's not even I don't have to hesitate. The people who need to use the future versions of healthcare are walking into Walmart once a week. They're already there, right? They're less than Amazon, then Apple, and then Google. Apple's done some really cool stuff if you can afford a $500 watch and a $1,000 phone, okay? Amazon is doing some really good stuff, and I admire the crap out of Amazon and their innovation, whatever. Yeah, not everything they do, not everything anyone does, right? Not everything Walmart does. But everyone who walks into Walmart is the people who need to embrace the next generation of healthcare delivery systems.
Yeah. Thank you. I'm going to switch just a little bit over to the entrepreneurial side. Because there are a number of entrepreneurs participating in the academy. And the question is, through the experience of creating Heal and developing it and then exiting Heal, what was the major lesson that you learned in Heal that you're applying in HeyRenee?
So I got it. This is one of those questions when people ask, I'm like, how much do you have? Because I could talk for days about lessons learned. But the two or three that I would say is, the most important one I would say very quickly is know your weaknesses and have great people early that complement. I'm good at this. Renee's good at that. Let's get a person good at this, and that, right? In this new company, HeyRenee, our chief product officer, Alexander Cohen, who we were fortunate enough to hire out of Particle Health, is the product equivalent of Renee as a clinician and me as a forward-facing CEO, right? The second one is pick your investors carefully. You can get money from a lot of people, right? Especially right now, there's a lot of money sloshing around digital health. Companies are oversubscribed. Pick people who will genuinely add value. Great investors make the difference between great outcomes and not great outcomes. And we, with HeyRenee, wanted to pick excellent, truly value-add investors. And with Morgan at Quiet Capital and Amit Garg at Tau Ventures and Ava at Fika Ventures, and Will at Mucker Capital and others, we really did pick world-class investors, which we're very happy to have.
Yeah. Another question along the entrepreneurial line. John Schufelt, who founded MeMD that Walmart just purchased as the telehealth application, talked about, he was a serial entrepreneur like you, and talked about some of his failures. I think one was Dead TV. And others. And I'm wondering if you have experiences with startups that failed or major lessons you learned along the way.
Yeah, again, I could go on for hours. I can't tell you how much failure. I don't even look at it as failure. It's you're an alchemist and you mix stuff and some of it will turn into gold and a lot of it won't. And I always say to people, I don't need, Michael Jordan, he always talks about, I missed how many shots he missed in his career, but he wasn't afraid to take the ones that counted, right? The difference between great entrepreneurs and not great entrepreneurs is not that great entrepreneurs make less mistakes. It's that they're not afraid of them, right? So there are hundreds and thousands, but I will say a few that I've made is, one is being honestly too respectful of input, if you will, right? Being a great entrepreneur is about listening to your customers and listening to your investors, in particular to an extent, but it's about saying, I know what I need to do, and this is what I need to do. You're the visionary. You're the one with a vision. Chase it, pursue it, and listening, trying to make people happy along the way will make no one happy, because guess what? You won't build a product you want, and they don't care that you listen to them. They just care that the exit wasn't what it should have been, right? Correct hiring mistakes early, quickly. When you keep people on that don't be cavalier and don't try to be better about hiring, but hiring isn't an exact science. Make the cuts early, right? Hire slow, fire fast. Why? Because when you don't, you are robbing your investor money from the people who do deserve to be there, right? It's opportunity cost. Don't fester, don't linger. And the third is, don't let the market decide for you. Make a decision of action rather than one of inaction.
Yeah. Great advice. Thanks. I'm going to switch back over to the transformation and a question related to for the vision that you've outlined for healthcare delivery. What are the regulatory changes that need to take place for the vision to be possible that you outlined?
Look, I think the fundamental regulatory changes some of them are already happening, right? Relaxing interstate licensing requirements. It should be that our doctor in California is a doctor in Arizona. And right now, the interstate licensing requirements, at least pre-COVID, are really a hindrance to the availability of telehealth. And it literally used to be that the early telemedicine companies would go get a doctor and get them licensed in all 50 states, right? As opposed to medicine should be medicine, right? Now, I say that living in California, and there are some states that I think are less advanced in some of these areas, but I think that's one key area, right? The other key area is more clearly defining value and value-based outcomes, right? The government is making a strong push into value-based care, and it should. But is value-based care about saying someone is sicker, increasing the risk score, and taking more of our tax dollars, right? It should not be. That should not be that easy to game. It should be about actually improving outcomes, right? So truly aligning incentives. A third area should be about doctors should be able to allow it to use their judgment to deliver care in the best method possible for the patient, and that should pay what it pays. And if it's a phone call, a video, You don't need to see a patient on video a lot of the times. Yes, you do have an infection. Yes, take this antibiotic. Yes, it will cause you nausea. Yes, drink a lot of water. No, don't take grapefruit juice with it. None of that requires a video call. Sometimes it does require a video. We trust doctors to prescribe medications and administer surgeries and life-saving procedures, but we won't trust them to decide where care should be given, right? And by the way, I will say this, although it's a little bit off topic, mandate the COVID vaccine, for crying out loud.
So last question, and that is, you know that the narrative within healthcare is that it's too regulated, too complex. You have to know it from the inside and outside organizations, the Walmarts, the Amazons. Just it will not be disrupted like retail and banking and other sectors that we've seen over and over. How do you weigh in on that?
You think retail didn't get disrupted by an outsider? Banking didn't get disrupted by an outsider? Who's a more important company in banking right now, Bank of America or Acorn? Right? I would say Acorn. What is that, Venmo or your credit card? Right? Ask any person under the age of 30, right? So it will be outsiders who disrupt healthcare. And the people saying that are actually entrenched and ensconced in health systems, sticking their sand in just like retailers did about Amazon 20 years ago.
Yeah. Nick, this has been really inspiring and really helpful. Thank you so much for your time. Thank you for being with us today. I think we're going to a 2-minute break, and then we will be back for the session following that. But thank you so much for being with us today. Actually, Jeremy's here and going to take us to the break.